Geiger Investments presents the Retirement Focus Academy with Kevin Geiger. There are many pieces to the modern retirement puzzle. This show talks about those pieces of retirement and the tools used to help the retired and soon to be retired toward their lifetime goals. The Academy is on the air.
Welcome to Retirement Focus Academy, powered by Geiger Investments and Kevin Geiger. You can find out more about the team just by going to the website, GeigerInvestments.com, G-E-I-G-E-R, GeigerInvestments.com. And of course, the show, Retirement Focus Academy, because Kevin and Lauren have started the non-for-profit Retirement Focus Academy, did that several years ago, but it's a no charge to you. It's a great resource for anyone nearing retirement or already in retirement. You got questions, whether it's Medicare, whether it's Social Security, whether it's, hey, my portfolio, I'm a little nervous, the markets are getting a little volatile, what should I be doing? There is something for you, no matter what area of concern you have or want to learn more, basically, just by going to the retirementfocusacademy.com website. A lot of great information there, and it's always free of charge to you, retirementfocusacademy.com. Hey, Kevin, how are you?
Doing good. Yeah, it's definitely a busy time of year for us, with Carolina Medicare. We're just cranking away, just with open enrollment, with everything else going on. So a lot of decisions people have to make, and, obviously doing the show at this time of year, we like to do a lot of stuff around Medicare, just because I think it's probably one of the most important topics going up to December 7th. So, it's neat to be going through this stuff, and we've gotten a lot of phone calls and a lot of people looking for some guidance. So I'm happy to be here, and I'm happy to keep doing this show and bringing good information for everybody.
And I think this is going to be kind of fun, today, because for me, I'm almost 62. So in theory, I'm 3 years away from Medicare. And before we did this show last year, I didn't know anything about it. So it's really been kind of an eye-opener for me. And today we're going to kind of maybe talk some basics and maybe dumb it down a little bit. And Kevin's doing that for me so I can follow along with all of this. But you think about it, it's really interesting because there's Medicare Advantage, which is Part C. So Part A, basically hospitals, Part B, doctors, and there's other things within those. Obviously, Part B is what you pay for. Part A, if you've worked enough, it's a free deal for you. Part C is Medicare Advantage. So when you hear that, you go, okay, well, that's just part of the government's run Medicare. That's not the case. Kevin will clear that up today. Part D, drugs, and then you get into the supplements or Medigap, and you're like, well, wait a minute. There's three different things. There's Medicare Advantage, there's Medigaps, and there's Medicare supplements. Kevin, come on, clear that up for us. Are there three different things when we talk Medicare Advantage, Medigap, and Medicare supplements?
Well, that's just when it comes to Medicare, it's all about the alphabet, right? So you get A, B, C, D, G, you name it. It can become a very big confusing topic across the board because it's real important for people to understand. So when people call Medicare, like the original Medicare plans, they're talking about the ones that started a long time ago. That's the original ones, right? That is your A and your B. So A is really covering your brick and mortar, as we call it, your hospital, general nursing, skilled nursing facilities, things like that, right? And then B is going to be covering your doctor visits, your vaccines, your mental health exams, and so on, and things like that. So it's important to understand that, when you've worked, good 10 years of your time paying into Social Security, and also what gets paid into Medicare, you qualify for Part A for free, which is neat. So as long as you paid in for those 10 years, those 40 credit hours, then you've got that for free. And then obviously from there, you've got to pay for Part B on a monthly basis. But, I would say Medicare as a whole, in my opinion, is probably one of the best insurance plans out there, especially coming from the private sector, when you're younger and you don't have that option to have that stuff. So it's important people to understand that. So now when you're talking about Part C, right, the next letter in the alphabet, that's your Medicare Advantage plans. Those are privatized, Medicare. So what A and B is to you, if you would decide to go C, it would replace your A and B and become C only, right? And then you get into the drug coverage, which is your Part D. So think Part D for drugs. That's going to cover prescriptions and things like that. And then when you get into all the rest of the letters, now we're talking about your Medicare supplement or Medigap. I always like Medigap.
You're saying those are the same things, Medigap and Medicare supplements.
Correct. Yeah, and I always like, Medigap I think is a better, name for it. And the reason why I think that is it really is filling that gap. When you have your Part A and your Part B, you still have a 20% co-insurance. So, you end up having a $1,000 bill, you're still going to be paying $200. Well, now the Medigap plans, depending on which one you want to pay a little more money for, Can, for example, if you had G or if you have an old F plan, for example, it'll cover that other 20% coinsurance. So your out-of-pocket expenses on the medical side can really be eliminated as much as possible by adding a Medigap or Medicare supplement plan, to cover that stuff. So that's kind of the differences between all the stuff with Medicare, but there's a lot more that goes into this stuff, and I think we're going to talk about a lot of things that I think are really, really important across the board.
Absolutely. So here's the interesting part of this, I think, is that, okay, we've worked for 10 years at least, the 40 credits or whatever. That gives you Part A. Then you have to pay for Part B. Well, with Social Security getting a cost of living bump of 5.9% for next year, which is great. You're now going from $1,550 ballpark of average Social Security this year to about $1,640. That's kind of a ballpark number as the average. But with that, Medicare Part B premiums are going up from $145 or so to almost $158.50 or something like that. So you do end up paying more. So let's talk a little bit about that deductible with Part A, Part B. How does that work?
Oh, that's just it. So, when you're talking about Part A, anytime you have what's called basically your coinsurance. So and you think about Medicare is everything's really about coinsurance more than it is about deductibles. There's a few deductibles, but majority of stuff is coinsurance, right? So for Part A, for any thing you do, maybe you're in the hospital, you get hurt, and you have to have some care done, and you have 1 to 60 days. Well, you're basically subject to $1,408 of cost. And then anytime beyond 61 days and 90, there's no other cost to that. Now with Part B, you have to worry about, obviously, there's a deductible you got to be paying for. So every year you have the deductible costs that you're going to have to pay for. And then outside of that, you now have that 20% coinsurance. So it's really important for people to really understand that coinsurance of 20% has no limitations to it if you're just on Part A and Part B. Very important for you to understand that. So that means that you could be very exposed if, God forbid, there's something wrong health-wise and you have a lot of medical expenses throughout the year. That 20% coinsurance and the Part B could really add up. So it's important for you to understand if you're just on a Part A and Part B and you're going, wait, hey, Kim, well, that's what I am. I'm on the original Medicare. You got to understand there's some expenses that you could be subject to that have no limitations. So, we'll talk about more options, with the Medicare Advantage plans and supplements, obviously, and Medigaps and so on, that you could add on that is really going to help reduce that liability that could be detrimental to your retirement savings account. So that's really important for people to understand. And as far as the annual cost, we were talking about that for Part B. So $158.50 is, what it is for this new year coming up. But if you are filing single and you make more than $88,000 a year, or if you file jointly and you make over $177,000 plus a year, you will end up paying more money than the $158.50. Now, that doesn't mean, and people always go, well, that's fine because I retired last year, so my income's lower. Well, here's the news flash. There's a 2-year look-back period. So you could be subject to higher premiums for the next couple of years, especially if you just retired, because you might end up blowing past those thresholds. So it's good for you to understand that Part B might be a sticker shock to you for the first year or two because of the fact that you have higher income. So there's a lot of quirks to it, but it's important if you understand these things, you can kind of plan ahead and know what to expect.
So if you have any questions about any of this, because it can get confusing, the annual election period every year, October 15th through December 7th, and it's really for Medicare Advantage. Or if you're on a supplement or gap policy, you want to move to Medicare Advantage, this is your opportunity. It's also to change the drug plans, because drug one year might be $5 and next year it's $100, and you need to know that kind of stuff. Call the team at Carolina Medicare, 843-868-6334. There's no cost for this. 843-868-MEDI. That is 843-868-6334. Glad you're with us today. We're talking about Medicare Advantage versus Medigap. Now, here's an interesting one, I think, because Medicare, we all know, it's the largest health insurance program offered by the U.S. government, serving now more than 63 million people. So original Medicare, as you said, is Part A and B. Medicare Advantage is Part C, and just by that, we think they're all tied together. That is not the case.
That's correct. And that's, and sometimes I wish they wouldn't even call it, really just Medicare A and B should have just their own thing, right? And Medicare Advantage shouldn't even be called Medicare C, because it is confusing, right? And people don't understand that because they think it's a government plan. But the difference is when you're doing a Medicare Advantage plan, you're basically saying, hey, I'm going to go through the insurance company, and which has to follow the guidelines that Medicare puts in place for these Medicare Advantage plans, and I'm going to privatize it, meaning that the premiums that you already paid into Part A and the premiums you're still paying in for Part B every month are now going to go to the insurance companies, and now they're going to basically put the plan together, set out-of-pocket cost limitations and things like that could really be, good for you, I think, long term, especially if you're only on Part A and Part B. You got to understand you could have some pretty big expenditures down the road. And on top of that, most of these plans, include a Part D drug coverage. So what's neat about this is you already have drug coverage built into some of these Medicare Advantage plans. And on top of that, probably one of the best things I like about it is Medicare Advantage plans most of the time nowadays are a zero cost. So all you're paying for is your Part B going forward, and now you have a plan that has a lot more bells and whistles to it. And that is a really big, important thing for people to understand. So people always say, well, I already have Part A and Part B. Why should I go and C? Well, I go, well, first off, it's about limiting that out-of-pocket expenses, but it's on top of that is maybe getting some more bells and whistles that are going to be a better fit for you.
How many different types of Medicare Advantage plans are there? I mean, it's private insurance companies doing it, so I suppose a lot of insurance companies actually have their own Medicare Advantage plans?
Yeah, and so you think about when you were working, obviously, and especially if someone's maybe just going into retirement now, or just going on the Medicare plans and they're just getting off their private insurance, you had your HMOs, you had your PPOs, and all those kind of things. So there's different types of things, right? So there is an HMO. There's an HMO point of service, which allows you to get more services out of network at a lower cost to you. There's an MSA, which is your medical savings account. There's your preferred provider organization, your PPOs, right? And then your PFFS, which some people say, what is that? Okay, well, that's private fee for service. These are things that are negotiating costs down. So it depends on what your needs are, right? And then there's the special needs thing. So maybe you have special needs health-wise. Maybe you're disabled. Maybe there's situations where you have Medicaid and things like that. Well, the great thing about that is, and I always tell people, I go, if you're on Medicaid right now and you have Part A and Part B, I'll give you a news flash. If it were me, I would, probably give us a call and say, hey, I'm on Part A and Part B. I'm on Medicaid. And, I heard you talking about this, and I'm going to tell you, you can actually go onto the Medicare Advantage plans, have all these bells and whistles, which we'll go through, of all these kind of fun things, all that co-insurance stuff that you could be subject to down the road. All that stuff doesn't exist. You kind of get all the stuff in a sense for free. So we ran into a lot of people last year calling in saying, I'm on Part A and Part B, I have Medicaid. Is there anything I can do better? And I'm like, absolutely. And so it was neat to kind of show them this stuff and show them that it was going to be no cost to them and have more benefits. So there's so many things that Medicare Advantage plans can provide to you. If you just have Part A and Part B, this might be something worthwhile to looking into.
All right, final question before we get to the next half of our program today, and that is, we are in the annual enrollment period, the annual election period of October 15th through December 7th. Is this an important time period for us if we have Medicare Advantage?
Yeah, this is a very important period, right? Because this is the time when you have the ability from October 15th to December 7th to make changes to your plans. If you're currently on a Medicare Advantage plan and you're paying a premium every month, highly recommend you reach out, because I can tell you, majority of these plans are becoming free, so there's no cost on a monthly basis, and these options and features and everything else inside, the bells and whistles, which we'll get a chance to talk about, are all getting bigger and better. So, you might end up getting more for less in a sense. So that's really important for you to understand. And more importantly, you got to be reading your annual notice of change. There are changes happening every year, and your plan might not include your doctors or your prescription stuff going into the new year. So this is the time where it gives you a chance to evaluate if the new plan or your current plan is going to be right for you going into next year.
Final point, and that is this. If I called you and said, hey, Kevin, I'm not really sure what I should be doing here in this Medicare world, the annual election period. I might be thinking maybe I should change, but I don't really know. How much do I have to pay you?
Well, that's the best part. So you can work directly with us at zero cost to yourself. The insurance companies pay us, and because we're a broker, we work with every insurance company that's available in the area. So we're going to find the best plan for you. So whether you go through the insurance company directly or you go through us, the premium's the same. So you might as well take advantage of free advice and let them pay us to guide you to make sure that you're getting everything covered with your drug coverage, your doctors, and everything else. That is the most important thing that I always tell people. Don't bother calling the insurance companies that are constantly throwing these ads all over the place. Call us. We'll get you through those insurance companies and figure out which one's right for you and make the right decisions. So your new year is going to be phenomenal and hopefully cut costs and have new bells and whistles.
Yeah, I like that. You get the advice, and there's no cost to you, because Kevin and the team at Carolina Medicare get paid from the insurance company. So it's a great opportunity for you to learn more, make the right decision for your situation with some guidance from people that actually understand this Medicare world. Again, the number at Carolina Medicare, 843-868-6334, 843-868-MEDI, M-E-D-I, 843-868-6334. No cost, no obligation for this. They're here to help. And again, you can always go to the website, carolinamedicare.com. carolinamedicare.com. Back with Kevin Geiger right after this. This is the Retirement Focus Academy, powered by Geiger Investments, and we're talking Medicare made simple. Back right after this.
Unexpected medical bills can be devastating in retirement. According to the Bureau of Labor and Statistics, for someone 65 and older, healthcare accounts for more than 13% of the household budget on average. Kevin Geiger and his team at Carolina Medicare design retirement plans for all contingencies. That includes strategies to cover healthcare costs. Call them today at 843-868-MEDI. That's 843-868-6334. Carolina Medicare puts Medicare's alphabetical soup through the strainer to help provide you effective coverage. Kevin and his team can help take the guesswork out of finding the right Medicare supplement. Call Kevin Geiger and his team at Carolina Medicare to schedule a visit. Call now, 843-868-MEDI. That's 843-868-6334.
Welcome back to the Retirement Focus Academy, powered by Geiger Investments and Carolina Medicare, with Kevin Geiger. And Kevin, some kind of new and exciting news. By the way, if you have questions about any of this, you can always go to the website carolinamedicare.com. Since we're talking Medicare on the program, you can always call Carolina Medicare with guidance. There's no cost to you. They can even find the exact plan that you should be on that makes the most sense for you. You don't pay them anything. The insurance companies pay them. So this is a way to get free advice, basically, to make the right decision. 843-868-6334, 843-868-6334. But your wife, Lauren, is now Medicare certified. Is that the way you would say that?
That's correct. Yeah. So she's always been a big help, and she's definitely.
So do I finally get to talk to her on the radio show then?
Oh yeah, she'll be on here. Right. So she's got to get more involved in it. She's been involved in the past, but we've just seen such a big drive for people looking for assistance. Because let's face it, more than 10,000 people a day are turning 65. So these are more and more people going on to these government programs, particularly Medicare. So, I think everyone's trying to realize that, it's so confusing. The Part A, the Part B, C, D, G, you name it, every letter in the alphabet, it's making it more complicated, and there's just too much bad information all over the place, not giving you the right guidance. So to be able to offer these services for free for everybody is amazing. So she's definitely getting more involved, and I'm super excited for her to be a part of the Carolina Medicare family.
Great. So we are in the annual election period right now, October 15th through December 7th every year, and the same dates every year. And it's really for Medicare Advantage. If you're in Medicare supplement world, you can change those at any time if your health is good enough. So you can do that kind of during the regular year. But Medicare Advantage, this is the time. And it's for Medicare Advantage and for the drug plans, Part D. And last year, I remember you were talking, there was a big deal about insulin. And 60 Minutes had done stories about, hey, insulin's costing so much, people are going over the border to Mexico and buying insulin because it was so much cheaper than getting it here. And now that was a big push last year in the drug plans. Insulin became more affordable. What changes have you seen for Medicare Advantage for next year?
Well, so one of the big ones is pest control. So if you're just not in a healthy condition right now, requiring more care and everything else, and so you're doing everything through your Medicare Advantage plan, for example. Well, now a lot of these new Medicare Advantage plans are actually covering pest control because what they're realizing is everything is about preventative health care, right? Shocking, right? For years we've been saying that insurance companies just never want to pay for anything, right? Well, now they're starting to realize that if we can prevent people from getting super sick, and one of the biggest things is, maybe they might not live in the cleanest house and they have a lot of bugs around the place. If you have pest control to take care of that stuff, that could help eliminate a lot of the problems that could be, brought on by all these little pests that are everywhere in these houses. But on top of that, we're talking about, every year the cost goes up, right? So the standard deductions and stuff like that, or standard deductibles, have gone up and stuff like that from $445 to $480. The initial coverage limits, went from $4,130 now up to $4,430. But the most important one, which I always talked about, was your out-of-pocket limits, right? Your threshold of what you could be expected on a yearly basis to maximum be paying out with a Medicare Advantage plan. Because if we talked about it earlier, as we said, Medicare A and B, you're subject to a 20% coinsurance that you have no limitations on. Well, if you had a Medicare Advantage plan, for example, right now for the new year, your maximum out-of-pocket cost is going to be $7,050. It might seem like a lot of money, but imagine if you were dealing with some massive care issues and you're going in weekly and things like that, how expensive your bill would have been if you had to still have to pay that 20% coinsurance. So having some limitations on your out-of-pocket limits will really, really do you some well and help keep that cost down so you don't have to worry about, again, blowing through your retirement savings, because it's the last thing you want to be thinking about. I'd rather you enjoy your life. I'd rather you go spoil those grandchildren, take some vacations, do things, and know that you at least have some limitations on your expenses when it comes to healthcare.
So Medicare Advantage known as Part C, and Part C means that the Medicare Advantage plans are through private health insurance companies, and they take the government's Part A and B and roll them into the Part C, and they typically come with obviously with the drug plans, but you can also get maybe some dental, vision, hearing coverage as well in these. What are some of the misunderstandings, Kevin, when it comes to Medicare Advantage plans?
One of the big ones is, well, I'm with the original Medicare A and B. That's the best. And it's like, well, no neglecting the fact that, A and B is an amazing insurance, especially outside of when you come outside the private world where, you're finally getting on Medicare. But you got to understand that, all that really covers is just your health care, right? And that's it. And then on top of that, again, you have that 20% coinsurance. But if you have, for example, if that's all you had, I would highly recommend you at least look into a Medicare Advantage plan because you are going to get more. You're going to get, most of the time, you have prescriptions built into these plans. You have vision, hearing, dental, free meals delivered to your house, free gym memberships or the silver sneakers, if you ever heard of that term. That's what they're talking about. Free transportation to your doctor. And majority of these plans are zero out-of-pocket cost to you on a monthly basis. All you're still doing is paying your Part B, and that's it, unless you still have to pay in a Part A. But that's the beauty part of the whole thing. So I always tell people, if you have Part A and Part B, it might be worthwhile to consider the idea that Medicare Advantage might offer more features and, again, limit your out-of-pocket cost to yourself. Again, $7,050 is your maximum out-of-pocket cost for next year. That could be very important to you across the board, especially when you factor in prescriptions and things like that. And then, people always go, well, there's no such thing as free. Well, you got to understand, when you look at this, it's privatizing the insurance. The insurance company is getting that monthly money that was paid into Part A and the money you're paying into Part B, and now they're forming the plan that has to follow the Medicare guidelines in regards to the Medicare Advantage plans. So you are going to get a lot more features in there because, again, insurance companies, in my opinion, typically manage things better and especially handle things when it comes to healthcare and things like that. And then another thing is, being handcuffed. Well, if I switch to Medicare Advantage plan, I'm stuck. That's not true either. You could sign up for that and maybe you don't like it and you want to go back to Part A and Part B for some reason. You can do that. You're not locked into these things completely in many cases. There's some outs. The insurance companies have put these things in place. And the last thing is, I think it's really important for you to understand that 62% of people that are on Medicare right now are actually on a Medicare Advantage plan. 62%. So that's 6 out of 10 people that are actually on Medicare Advantage plans. There's a reason for it. A lot of times they just don't want to pay the cost for, Medicare Medigaps or Medicare supplement plans, for example, and they just want all these bells and whistles, and they realize they want to limit their exposure financially on a yearly basis, so they end up going with these Medicare Advantage plans. So it's important for you to understand, if you're on Part A and Part B only, it might be worthwhile to at least take a snapshot to see if this plan would actually work really well for you, or if not, you can still stay on the A and B and do what you're doing and stay the course.
Yeah, if you'd like a little guidance, call the team at Carolina Medicare, Kevin and Lauren and the team, 843-868-MEDI. That's 843-868-6334. So glad you're with us today for the Retirement Focus Academy, powered by Geiger Investments and Carolina Medicare. And Kevin Geiger, I'm Mark Elliott. It's always interesting because the annual election period is always October 15th through December 7th, and it's really for Medicare Advantage and the drug plans, Part D. That is what you can make some changes, and things change, and you probably don't read those little things that come in the mail that, hey, they changed this, they changed that. You don't want to get shocked the next year, basically is what we're talking about. One thing, though, that you do hear, Kevin, a lot is that people that, let's say they're 70, so they've been on Medicare now for 5 years, whether they were Medicare supplements or Medigap or Medicare Advantage or just Parts A and B like you were just talking about, a lot of times people get really brand loyal. Is that wise in this case?
And that's just it. I see a lot that we all become very brand loyal. Whether it's your cable company, whether it's your cell phone service, because everyone says, well, this one's the best one. And honestly, nowadays, I feel like cell phone services are pretty equal across the board for the most part. So I always say you better go where you're going to save the most amount of money. But when it comes to your health care, it's really important for you to understand that just because you had ABC company or ZXY at your work doesn't mean you have to stay with that insurance company, especially when it comes to Medicare, because whether you're on a Medigap or a supplement plan, for example, it doesn't matter what insurance company you end up going with because they still have to follow the exact guidelines of Medicare. So what's neat about this is it really comes down to what's going to save you money. So same thing with the Medicare Medicare Advantage plans. I always say, if they're free of cost to you, and we find the ones that include all your doctors, and we can look at the top 5 that include your doctors and prescriptions, so everything's covered there. Now let's look at who's going to give you the best bang for the buck, who's going to have the best dental coverage. Because you say, hey, my dental has never been the best, it's always been expensive. Let's make sure that's covered. Let's look at all these things. Maybe some more bells and whistles that might be a better fit for you. And now we narrow down that 5 down to one company, and it might not be a company you never worked with before, but it doesn't matter because they still have to follow the guidelines within it. So I think it's important to know that if you're brand loyal, this is not the time to be doing this. Make sure you find the right plan, cut the costs down, make sure everything's covered, and make sure you're getting all the extra bells and whistles that you want that's going to be the right fit for you, especially going into 2022.
Absolutely. And I want to make this point very clear as we wrap up today's program. At the end of the day, it comes down to knowing that you have Carolina Medicare free of service for you. There is no cost to use Kevin and Lauren and the team at Carolina Medicare. You don't pay for their services. Your rates are the same whether you go with Carolina Medicare as your broker, per se, or you go direct to the insurance company. So why not get professional advice, which also then hopefully will help you make the right decision for you and not a wrong decision that you'll regret later on. Let's make the right decision up front, and then we're better off going forward. All it does is start with a phone call to the team at Carolina Medicare, 843-868-MEDI. 843-868-6334. Again, there's no cost for this. There's no obligation. You can sit down with the team, and they might tell you things, and you go, well, I think I'm going to go do it myself. You can certainly do that. They're not going to bang you over the head, lock you in the office. No, they're here to help. That's what they want to do, and there's no cost to you for that help. I think that's really important. 843-868-6334. You can always go to the website, carolinamedicare.com, to find out more. Kevin, a lot of information we covered, and I know we're going to do the same next week. Enjoy the rest of the weekend. Have a great week. We'll do it again next week.
Sounds good, Mark, and take care, y'all.
This has been the Retirement Focus Academy with Kevin Geiger. Advisory services offered through Black Ridge Asset Management, LLC, a registered investment advisor. Securities are offered through Peak Brokerage Services, LLC, member FINRA and SIPC. Black Ridge Asset Management, LLC, and Geiger Investments are separate and independent entities from Peak Brokerage Services, LLC. Investing involves risk, including the potential loss of principal. Any references to protection, safety, or lifetime income generally refer to fixed insurance products, never securities or investments. Insurance guarantees are backed by the financial strength and claims-paying abilities of the issuing carrier. This radio show is intended for informational purposes only. It is not intended to be used as the sole basis for financial financial decisions, nor should it be construed as advice designed to meet the particular needs of an individual's situation. Blackridge Asset Management LLC is not permitted to offer, and no statement made during this show shall constitute tax or legal advice. Our firm is not affiliated with or endorsed by the U.S. government or any governmental agency. The information and opinions contained herein provided by third parties have been obtained from sources believed to be reliable, but accuracy and completeness cannot be guaranteed by Blackridge Asset Management LLC. This radio show is a paid placement.